We know that renal impairment is seen commonly in patients who are undergoing chemotherapy. However, the prevalence of renal impairment in patients is not really well known. Because our company develops drug for cancer patients, we wanted to have an idea of what the baseline prevalence of renal impairment that's broadly defined as a combination of acute kidney injury as well as chronic renal failure and proteinuria at all stages is in order to be able to evaluate the nephrotoxicity of our drugs once these patients receive it. For that reason, we conducted this study using a well-known epidemiologic database at Henry Ford Hospital to evaluate the prevalence of renal impairment in various cancers. We looked at patients who had lung cancer, colorectal cancer, as well as breast cancer, and using the data defined here, possible renal impairment, renal impairment, or laboratory abnormalities, we were surprised to find that a significant number of these patients have renal impairment at baseline, and this was in the order of 18 to 20% in many of these patients, and this was across various cancers. So we're thinking that this information will be helpful for us now to go forward to evaluate our drugs and evaluate our patients to see whether administering this drug would alter their renal function or whether this is something that was present already at the baseline, and also that also helps the oncologists to be more attentive when they're treating this patient with these potential nephrotoxic drugs.